Today, we will be introducing you the important bony prominences for goniometry. The first bony prominence is the C7. The second one is the tip of the acromion process. The third one is the posterior superior iliac spine, or the PSIS, which crosses the S2, which is another important bony landmark in goniometry. And the last bony landmark is the greater trochanter. These may not seem important, but as we explain further in goniometry, you will see the importance of bony prominences that I have pointed out. The thoracolumbar extension and flexion has the same bony prominences, namely the C7 and the S2. And you can palpate for the S2 using the PSIS, which is the posterior superior iliac spine, right here. So from here to here. So let's try with an actual patient. First, you palpate for the C7, which should be here. And then you go down and palpate for the posterior superior iliac spine. And right beside that should be the S2. So from here, you measure it down here. So before your patient does any flexion or extension, you have to take note on what is the measurement of his back in resting position. So once you get it, you ask your patient, "Sir, can you please look down or flex your back?" Then you measure it again from C7 to S2. You take note of that and you minus the result that you find from the flexion with the result that you found with the resting position, and that is your result. So for thoracolumbar extension, it's practically the same thing as thoracolumbar flexion, using the same bony prominences. So you gotta palpate the C7 and palpate the posterior superior iliac spine to find the S2. So as the same before, you have to measure from the C7 to the S2 in the patient's upright position. Then once you have that, you ask your patient to extend his back. But before you do that, do take note that he would be unstable, so you have to call for a PT8. So PT8, can you please come here? This is my PT8. Sir, Mr. PT8, can you please make sure that he is stabilized by holding the side of his pelvis? Okay. Now that the patient is stabilized, now you can commence thoracolumbar extension. Sir, can you please lean back as far as you can? Okay. So again, from the C7 down to the S2, measure whatever is there, and once you have the result, thank you, sir, you can be upright. Thank you, Mr. PT8. You take whatever you find in the thoracolumbar extension and minus it with his measurement when he was upright, and there's your result. The next thing we're going to be doing is finding the bony prominences for the thoracolumbar rotation. So you start from the tip of the acromion process and go all the way down to the greater trochanter. So you ask your patient to either go left or right in rotating. So when you do right thoracolumbar rotation, you have to start from the right acromion process and end at the left greater trochanter, and vice versa. If you're going to do left, you have to go from the left acromion process to the right greater trochanter. Now for thoracolumbar rotation. So the bony prominences for this is the tip of the acromion process to the greater trochanter. You can find that by first locating the posterior superior iliac spine. Cover the gluteal muscle like this, and from the pinky you move to his side. So that's how you find the greater trochanter, if you don't really know how to find it. So that's a rough estimate. So from the tip of the acromion process to the greater trochanter in its upright position. So once you get the measurement, so depending on where he rotates, you have to place it in the correct acromion process and the correct greater trochanter. So when he rotates to the right, it has to be placed from the left acromion process to the right greater trochanter and vice versa. So before you do that, PT8, can you please come here? I need you once again. You need to stabilize his hip first. So PT8, can you please stabilize the hip? Thank you. Now, tip to the acromion process, greater trochanter, then take the measurement, and sir, can you please rotate your body to the right? There we go. So from here, you take the measurement again. Whatever you find in the rotation, you minus it with the previous one, the one where he's not rotating, and there's your result. So the last thing I want to show you is lateral deviation of the thoracolumbar trunk. So basically, you go from the tip of the finger, of the middle finger, and go straight down to the floor. That's the most accurate way. Ask your patient to place his hands on his side. Make sure that he's straightening his fingers out, because you are going to take note of where his middle finger is. So his middle finger is right here. You take note of that, and you measure the distance from where his middle finger is to the floor. And then, after that, you ask your patient, sir, can you please bend to the side as far as you can while keeping your hands straight. So again, from the tip of where his middle finger is to the floor, you take note of that. And whatever you find, you minus it from when he's standing upright, and that's your result. So for the goniometer, we will be using the bony prominences for lateral thoracolumbar deviation. So the fulcrum should be at the S2. The distal arm should be at the T1 or aligned at the T1. And the proximal arm or the stationary arm should be perpendicular to the floor. So when you tell your patient to bend left or right, you usually follow the moving arm and still try to align it with the T1. So last but not least, the calculation of the angle for the thoracolumbar lateral deviation. You have to first align the fulcrum of your goniometer at the S2. And to find the S2, you need to palpate for the posterior superior iliac spine. So let's find it. There it is. The moving arm should be aligned with the T2. And the stationary arm should be perpendicular to the ground. So, sir, can you please bend to your right? Okay. So, again, align it to the S2, make sure this is perpendicular to the ground, and align the moving arm with his T2. And his back should be pretty much normal. For thoracolumbar rotation, we are going to be using the pelvic tubercle, the acromion process, and the center of the head. Now, since we don't have a head, we'll just imagine. So you align the fulcrum with the center of the head, the distal arm with the acromion process, and the proximal arm with the pelvic tubercle. So when you tell your patient to move, you follow the acromion process. So when you say, sir, can you please do right rotation, or can you turn right without moving your head? You follow the acromion process while making sure that the proximal arm stays aligned with the pelvic tubercle. So for thoracolumbar rotation using the goniometer, you have to align the proximal arm with the iliac crest or the iliac tubercle. And you use the distal arm and align it with the acromion process. And the fulcrum is aligned in the middle of the head. So it should look like this. So tell your patient, "Sir, can you please rotate to the right?" Okay. So you keep the proximal arm aligned to the iliac crest or iliac tubercle, and you move the distal arm and align it with the acromion process.